My first question really would be to Andrій Klепikov, whose health NGO is based in Ukraine. You know, what has been the impact of war on your operations and on the people of Ukraine?
Thank you. It's also important that this event started with the speech of the Minister Ляшко. It was so powerful and strong. And just picking up some of the things he pointed, like over 1,000 hospitals were damaged and destroyed. This is an illustration how civilian infrastructure is affected. Looking at the territories, we have over 7 million war refugees left Ukraine, and about 8 million moved within the country. It's the largest move since the Second World War, and this means a huge disruption in human lives. Of course, the latest attacks on the energy sector are so scary because in my home country, in Kyiv, I'm like 50-50 between Kyiv, the capital, and Lviv. I'm checking app with power cuts, planned power cuts for 8 hours per day. Like it's planned since 6 till 10 at the morning, and since 8 till 12 till midnight. This is an application to live in the capital with 8 hours before the electricity. Now, not in winter time. It's already causing a huge impact.
Thank you, Andriy. And could you talk a little bit about the different challenges you face in different parts of the country, and also the progress of the war? I mean, we started with health needs. You're an NGO that focuses on HIV, AIDS, and TB, but things have moved fast forward to today, and we're facing the prospect of an extremely harsh winter. I mean, how do you adapt?
Yeah, first of all, we are working shoulder by shoulder with the government and medical infrastructure. Example, on the occupied territories, all hospitals were destroyed, and people still need help. So civil society and community stood up and came with the mobile clinics, for example. We used before just for testing, for HIV testing, but now demand is quite wide for full range of services, including measuring blood pressure, providing basic care, etc. So this is an example how we modified the services from, hospital-based to be mobile and also more digital. All these people who moved, they're still using apps, chatbots, Telegram channels to get access to their medicines. And we are quite resilient. It's not only on the battlefield, but also in the medical and social sphere. When it was a difficulty for logistics to deliver medicines, for example, with our vans, we delivered TB medicines. When it was a shortage of fuel, we procured bicycles and did it by bicycles. So if it would be no bicycles, we will go by feet. But this is an illustration of the resilience, so we do everything to help people. And with the winter, it's getting more challenging. My feeling is that following the Stalin's organized artificial famine in 1933, when over 6 million Ukrainians was died, and it was acknowledged as genocide in many countries. Now Putin wants to kill civilians by cold this winter. It's really intentional strategy of the terrorist state and a crazy man on top of it. So it's critical to oppose it and not to be late. So now it's a critical time because it's getting cold now. So we are desperately need to add this humanitarian element to the health program we have to match and to get access to UN and other channels for the most vulnerable people.
Thank you. One further question. I mean, you've touched on these unprecedented movements of people within the country, out of the country, but also some people returning. I mean, what challenges do these movements pose to you? And you've talked about digital apps to keep track of people, but could you speak to that? And then I'd turn that to Oksana for a subsequent comment.
Yeah, we are very thankful to all states, EU states and other states receiving Ukrainian war refugees. At the same time, there are still a lot of challenges to get access to existing infrastructure because of the language barriers, disintegration, etc. So many people, even being in Germany or other countries, still keep in contact with Ukrainian doctors. And some of the regimes, especially for tuberculosis, are not so, well, TB is not a very big issue in many European countries, so some of the schemes even not available there. So many people are returning, but they don't have houses to return. They just run out of the money, cannot stay here, but they're returning to a desperate condition and now facing winter. So it's also really critical to support them with some basic support. We did a survey for HIV, the most vulnerable group for HIV. And before the war, it was 10 all HIV and health-related services. At the beginning of the war, it was evacuation and some other things. Now the top 3 is, first of all, access to food, basic need, access to warm clothes and be in warm, not to freeze, and third, mental health. I think everybody in Ukraine requires mental health support. It's just to bigger or smaller extent. In my area, HIV and TB, there was a huge fear that at the beginning of the war, in March and April, that it would be outbreaks in HIV and TB. And it didn't happen. This is an example of return on investment made in the government and in civil society, because initially when the war started, every service dropped out significantly. But then we renew, and we are continuing now to serve over 300,000 people, the most vulnerable to HIV. So, and TB. This is an example how resilient can be system be and how important EU and other countries' investment to keep the health level and health services functional.
It must be so difficult to be positive and optimistic in such a tough situation. So how do you think about the future? How do you plan for recovery?
Yes, thank you. I also would like to combine it with the lessons. One is quite common from COVID pandemic and the war. We need to speed up decision making. The decision which took to take years, we are taking in days. Months, we are taking in hours. And Minister Ляшко is a great example of this. This is a message to all policymakers. Second, it's really showed that civil society plays a bigger role than it was thought initially, sustaining healthcare, but also bringing humanitarian element. Unfortunately, share of humanitarian support to civil society is still very small. It's 0.1%, the smallest in comparison with any other sectors. If someone asked to me, we are serving 300,000 people, asking for food and bread, I cannot say, sorry, I have just condom for you. We have to be relevant, and we shouldn't say no in the context of war and humanitarian crisis. So it should be access to low threshold humanitarian aid. And finally, rebuilding. We are optimists in Ukraine. We have no other alternatives. This is the war not against Ukraine. This is the war against fundamental values and principles we all share. So we don't have alternatives. We need to win this war, and we will win this war. But for this, we already started to think about rebuilding. And it's not returning to the past. It's not reconstructing what was before. We need access to new medicines, like long-acting ARVs, long-acting PrEP. We don't have it in Ukraine, but we need in treatment of NCDs, in mobilizing and digitalizing healthcare. This is our future, which starts today, and we need focus on this.